Good afternoon and assalamu alaikum. I would like to thank Abbott for the invitation to present clinical utility of flash glucose monitoring in pediatric population. So according to the American Diabetes Association and the SPAD, for type 1 diabetes patient to be well controlled, HbA1c must be maintained at 7% or below, and there should be minimal hypoglycemic episodes, minimal hyperglycemia, and reduced glucose variability. And for patients who are doing the SMBG, they should do 6 to 10 readings per day. However, the real-world data from type 1 diabetes exchange showed that patients from all age group between neonate and elderly fail to achieve the target HbA1c, and we see that the worst group are the adolescents and young adults. Furthermore, studies showed that 80% of children even fail to keep their HbA1c at 7% or lower, forget about the 7.5% or lower, forget about the 7%. And other studies showed that more than 50% of patients with diabetes have a fear of hypoglycemia, 25% of patients have hypoglycemia and awareness, and up to 74% of patients are reluctant to change insulin because of the fear of hypoglycemia. Let's remember that the triangle of diabetes care basically include improving glucose level, but on the top of that, we should limit glucose variability and avoid hypoglycemia. So as we can see, all three goals are focused around glucose monitoring, which is essential in all patients who are using insulin. However, looking at the real-world data about the SMBG status, again from the type 1 diabetes exchange registry, we see that only 20% of patients are doing 6 to 10 readings or more per day, and the average SMBG is about 4.7 per day, which is way below the target. And the reason because SMBG has multiple limitations. First of all, it is time consuming to do every single reading. Second, it is not very informative because it doesn't tell the direction of the glucose at the time of the testing. It doesn't have alarm to alert patient when glucose is abnormal unless they're testing. And the data cannot be synchronized with other devices or shared with family members or healthcare professional. It is considered costly for patients who will pay out of pocket if they want to do as many testing per day, and it cannot be done by younger patients or elderly patients. CGM represents a very reasonable alternative because we can obtain many more readings using the CGM compared to SMBG. They're done much easier and conveniently without doing any finger prick or any cleaning. We can see trend of where the glucose is heading, and we can see a curve of where the glucose had been for the previous several hours. There is alarm feature that can alert the patient to the abnormal reading so that they can do the testing even when they're not looking at the monitor. Data can be shared with the Wi-Fi with a family member and healthcare professional and can be synchronized with insulin pumps sometimes. And then time in range data is shown with the CGM download, which is essential now for diabetes follow-up and management. Now, one might ask, what about the HbA1c? Yes, indeed, HbA1c is the gold standard, has been and still for type 1 diabetes. It has many advantages, being easily available, not very costly. It has a very predictive value of the long-term vascular complications, and it can help managing some of the patients. However, it does have limitations. The main limitation, it does not tell us the variability of glucose and the extent of hypoglycemia. And in rare cases, it might be unreliable in patients with certain hemoglobin abnormalities. So HbA1c sometimes can be misleading. Show you example here. I'm showing you 4 CGM profile of 4 different patients, yet they all have about the same value of HbA1c. We all know that this patient, while not excellently controlled, but he's decently controlled. And this patient is quite different from the other 3 patients who have wild fluctuation in their glucose, and such changes cannot be distinct or distinguished by you looking at the HbA1c and can only be recognized when we look at the CGM data. The CGM profile is very informative and it has many elements of information. It shows us the percentage of the time the patient is using the CGM. It shows us the mean glucose for the set data or set period of time, which is usually 2 weeks. It does show the glucose variability, glucose management indicator for many of the brand, and more importantly, it shows us the time and range chart, which is now being used along with the HbA1c, as I will explain later on. It does show the ambulatory glucose profile, where we can see the mean glucose, reading between 25th and 75th percentile, reading between 5th and 95th percentile, and we can see the daily profile of the 2 weeks or the 1 week period that we are evaluating. The DCCT data has been extrapolated into time and range, and they found there is a very nice correlation between time and range and risk of complication of retinopathy and microalbuminuria. It has been now estimated that for every 10% increase in time and range, there is 40% reduction in microalbuminuria and 64% reduction in the risk of retinopathy. The use of CGM has been strongly recommended by all the international societies of diabetes and endocrine. And in 2019, a new guidelines has been set on the top of the HbA1c that time in range should be maintained above 70% for patients with type 1 and type 2 diabetes. And this could be 60% for patients with higher risk of hypoglycemia if the HbA1c is 7.5%. Now, roughly estimation, time and range of 70% equivalent to HbA1c of 6.7%. Time and range of 50% equivalent to 8.3%. Every 10% increase in time and range equivalent to drop in 0.8% in HbA1c. Freestyle Libre is one of the multiple CGM devices. What makes it so unique? There are multiple features. Number one, it has a 2 weeks sensor duration, which is the longest in the market. It has a transmitter and sensor that are incorporated together, so there is no reason to click them or detach them in certain circumstances, especially when they're installed and detached or removed. No calibration is needed for the whole 2 weeks duration. It is fairly affordable compared to the other CGM, especially for patients who are going to pay out of pocket. And it has become popular, and actually it is the most popular device in Tawam Hospital, as we have shown in a recent study. It shows a minute-to-minute glucose variability, and this makes patients much more confident, and even healthcare provider, when they make adjustment in the insulin regimen. Unlike the other CGM, it does show arrow indicating where the glucose is heading, and it shows a curve of the previous reading as well. Now, because of the Libre link that's basically used with the Freestyle, the data from the transmitter can be shared with family members, can be shared with the healthcare professionals, and can be transmitted into smartwatch. This will enable the patients, the family member or guardian in the case of children, and healthcare professional to be basically able to see the changes and make recommendations to the patients remotely. Are there studies showing benefit of using the Freestyle Libre on glucose or on diabetes control? Yeah, there are many studies. I'm going to show some examples. Here's a study of 76 patients who were basically followed for 8 weeks. They put 2 weeks on a masked CGM and then 8 weeks on regular CGM. And they wanted to compare the time and range and the HbA1c before and after the regular use of the CGM. And those are, of course, children and adolescent patients. And they noticed that there was 1 hour increase in the time range, 0.4 drop in the HbA1c, 79% drop in the need to do finger prick, and 94% of the time patients were able to make their own insulin dosing decision. The device has been addressed as being highly acceptable by patients. 90% of the subjects have reported that there was no interference with the daily activity, and because of the device, they were able to see the glucose monitoring or do glucose monitoring about 13 times more likely than the SMBG. Here's another study in 59 subjects of young adults and adolescents showing a drop in the HbA1c by 0.84%. And here's one important study showing that the use of the Freestyle Libre in adolescent patients has enabled them to detect 2.5 more hypoglycemia during the daytime and 6 times more hypoglycemic events during the night time. And the average frequency of monitoring per day has remarkably increased from 2.8 to 11.6. And this data from the DPV registry from Germany, Switzerland, and Austria. This is a total of 3,500 patients. And they showed that after 6 months and 12 months, there was a drop in the DKA by 50% and significant drop in the severe hypoglycemia with or without coma and convulsion. And the difference was sustained for up to 12 months. Not one type of DKA is usually dropped after the use of CGM. Here's one study looked at 47 patients who used the Freestyle Libre, and they have noticed that the frequency of mild, moderate, and severe DKA remarkably dropped in the subject from before using the Freestyle and after using it. And here's one study showing that all markers of quality of life have improved after the use of CGM by 3 months period. What about Freestyle Libre benefit in Ramadan? I apologize, some of these data repeated from the previous presentation who have attended. I'm going to show you 2 studies that use the Freestyle Libre and discovered important information during Ramadan. This is one study in 25 adolescents who were basically instructed to use the Freestyle Libre to assess the extent of hypoglycemia. And we have found that 5.7% of the readings were in the hypoglycemic range, which is equivalent to 1.4 hours per patient per day. And 69% of the hypoglycemic event happened between noontime and pre-iftar. And the vast majority of events were luckily in the mild hypoglycemic range. Very valuable data, could not be discovered without the use of CGM. And here's a study from Saudi Arabia. Dr. Abdul Wahid Agha used Freestyle Libre on 51 adolescent patients during fasting Ramadan. He instructed them to break the fast when they have hypoglycemia with symptoms or without symptoms. And he found that 10% of the hypoglycemic episode were detected by the free glucose monitoring, and patient did not feel the symptoms. And he concluded that severe hypoglycemia could be avoided because of the use of the free glucose monitoring on this patient. In summary, time and range is a metric of glycemic control assessment that complement the HbA1c and discover additional pieces of information. Tab 1, time and range provide additional information on glycemic variability that we cannot see by using SMPG or by using the HbA1c more importantly. Time and range has a linear correlation with HbA1c and same association with the microvascular complications. The use of CGM and time and range has been recommended as a standard approach in diabetes care by all the international societies of diabetes and endocrine. Thank you very much.